What I've been sharing with you is not a way to treat, mitigate, or cure disease by intervention. It is not medical intervention. It is improving nutrition, that we have the programs in our cells for normal structure function, normal life, to keep us in the normal zone. But our cells carry out synthesis to make everything that happens in our body work. Even our memory and our thoughts and our reactions and our emotions are products of biochemistry. And certainly there's an interaction between body, mind, and spirit that more and more is being recognized again in the human condition. But we're trying to emphasize here that, this is nutrition supporting standard therapy. The new head of the Center for Complementary and Alternative Medicine at Washington at the National Institutes of Health, Stephen Strauss, was interviewed in this issue of the Journal of American Medical Association. He points out that anecdotal reports, single case reports, even done by physicians, and testimonies that you can stack them as high as the ceiling, and that is not science, are a basis for national policy and insurance reimbursement. That they do guide you to do small preliminary studies designed to investigate potential benefits. Then you do larger studies if you see evidence to support that. And then you move to more formal scientific studies. And he states that what's going on now in the United States following the DeShay Act is frontier medicine research. And that date was February 23rd, year 2000. Now, this is the very first case that I got involved with, and it was an accident. This is a gentleman that in 1983 came to our emergency room at Dallas-Fort Worth Hospital. He was a city official. He came with chest pain, and they took this scout film, and when they saw this abnormal shadow, first thing they did was pop him back in the ambulance and take him to Dallas, where there was a heart team, because they thought he had ruptured aortic aneurysm. I'm sure most people are not used to looking at x-rays, but particularly revealing is the lateral, that in front of where the heart is right here, it is all whitish. And this is where air is in the lungs, and there should be a dark spot here in front of the heart where the lungs. But what they found out with arteriograms and examining him is that from his thyroid gland between his lungs, around his heart, down to a diaphragm was a tumor mass that was making that white material, and it was an embryonal sarcoma. These slits under the microscope, a piece of that tumor, are types of structures that you see in the early stages of the development of a human embryo. And yet here he is an adult that has these structures, and that's why it's called an embryonal sarcoma. In the literature, no patient that's had one of these, regardless of what type of treatment, has survived more than about 13 months. Here, a year later, the x-ray of his lungs, if you'll notice where all that tumor was, now you have air in his lungs. And his lung and his x-rays have been normal now for 17 years. The story behind the story on this is that back in 1981, about 3 years before he had the chest pain, Grand Prairie there between Dallas and Fort Worth, it was a small community, and it's typical in small communities. You have network marketing called gossip. And his grandmother, who was in her 90s, told her great-grandson, who was the official, who was having problems with ulcerative colitis, multiple bloody bowel movements every day. They're doing some research out here at the hospital on aloe. You ought to try it. He tried it, and it worked. He found out that if he got lazy and quit taking it, he would start having problems again, so it became a ritual that every day he drank his aloe juice. And when it came time and he had this tumor in front of his heart, between his lungs, when they were treating him with treatment that never works, I see him at Rotary now, 17 years later, on a regular basis. And I always throw my arm around him and say, I love to hug a walking miracle. But it was an accident. I didn't even know this happened until 5 years after he had normal picture here, and I was asked at our Rotary Club to give a presentation on our aloe research out at the hospital, and after it was over, he came up and says, Dr. Reg, I think you might be interested in my case. And we went back and finally dug up the information of how he had started on the aloe back in 1981. Very fortunate man. This next case, I got a call from a pediatrician in Dallas that I had known for about 30 years. And he said that his brother was sitting in his office, had come by to tell him he was on the way to buy his urn for his ashes. That about 6 years before, he had had adenocarcinoma of the prostate, and that he had had surgery, radiation, various chemical agents. He had had chemical castration, surgical castration, and then he came up with, when they scanned his lungs, over 100 metastatic nodules in his lung. He had so many of these that they thought it could not be prostate cancer. It usually goes to the lymph nodes, so they biopsied it, and sure enough, and on cases you have to always have the tissue biopsy. This is because of the glands, it's typical of prostate cancer, and it stains there in his lungs. They thought it might be tuberculosis or something, but no, it was the tumor. They told him there's nothing more that they could do for him, and they dismissed him by the big clinic that runs across the United States. And so he went by to tell his brother what he was going to do. He says, will you see him? He knew I was doing some research out at Dallas-Fort Worth Medical Center. And I said, sure, send your brother over. I will never forget that day, because the next day, two gentlemen had this white anemic body that they carried in and set in a chair that could not, he was about 81 pounds, he was so far gone he couldn't lift his head. His wife did all the talking, so far advanced. And the minute I laid eyes on him, I knew I had made a mistake to see him, and I looked at the ceiling of the office to myself and I thought, why did I agree to see this dead man? There's nothing I can do. But because they had brought him and lowered him there, we started a combination of glyconutrients alone and standard therapy that never works for this. The next week they brought him in and he had his head up. By the end of the month, with a little assistance, he could walk in from the parking right in front of the thing. By the end of the year, we repeated his scans and all those 100 nodules had disappeared. I got a phone call from a mutual friend, and he says, you don't know what a monster you've let loose in North Dallas. I says, what do you mean? He says, don't you know that, we'll call him Bert, is a lifelong tennis jock. And says he's going around now in his early 70s beating people 20 years younger and unmercifully beating them. So I called him up and I says, what's going on? And he says, oh, he was so excited. He said, I have more flexibility, more strength, more endurance than I've had in 20 years. Says, I can beat people now that I couldn't beat in high school, college, or over the years. And I can beat excellent tennis players much younger. It's fun. And his scans have been negative. It's about 13 years now. Guy sent home to die. I've talked to him on the phone in the last 3 months. 3 years ago, now that he's approaching 80, he took up I started to say ping pong, but he'll slap you upside the head if you say that. It's table tennis. And in his age group, he won the state championship and qualified to go to Las Vegas to compete in the nationals. Pretty good response in a gentleman that had been sent home to plan his funeral. And one of the reasons that I say have had the opportunity to be one of the most blessed people on planet Earth. One day I looked up from my desk in the pathology department, and there was a very lovely blonde-headed lady with two little boys, cotton head, stair steps, and she looked pregnant, but she was not pregnant. She told a story at approximately 28, she had breast cancer, and breast cancer in young women is a terrible disease. It's always terrible, but particularly aggressive at that age. And they removed her breast, and for over 5 years, every year she had a negative exam. In the 6th year, the plastic surgeons rebuilt the breast for her, but in the 7th year when she came in, she had a problem. The reason she looked pregnant, this is her liver, and there's fluid between the chest wall and here, ascites from metastatic breast cancer, the fluid in the abdomen. In her liver was this mass here of metastatic tumor, and then I'm only showing you one side, but there are about 10 or 11 ugly black places in her backbone where there was breast cancer like this nodule. And she even had a metastatic mass in her neck, which was biopsied. This is very undifferentiated cancer, mini mitosis. You wouldn't know where it came from, but with special stains, it was the old breast cancer. She stood there telling me she had just had another course of terrible mixed chemotherapy that made her miserable, and it did no good. And she had heard of research that we had done in animals, and she had flown in from Connecticut, and with tears in her eyes, she said, "Please help me. I want to raise these two little boys. Can you help me?" Here I am in Texas, she's in Connecticut. I urged her to go back to the oncologist and have them try what had failed in the previous sequence of treatment protocol, and to take the original glyconutrient that we started in our research from the aloe plant with it. In 6 months, she sent me this scan. Her ascites was all gone, and her liver was against the chest wall. This is a radiologist's marker pen that this is all that's left of the tumor that was in the liver. And as you went up and down her backbone, all the black, mean-looking tumor masses were gone, as were other masses in her abdomen. After this, she literally toured the world. Went to the Hermitage in Russia, went to the Valley of Kings, where the pyramids are in Egypt, went to the dig in China where the terracotta army is, went to the springs in over 100 of them in South America and that place called Monte Pucho or something like that. Saw the world and raised those little boys. And about 5 years later, she says, "I want you to quit calling me annually. I'm through being a cancer patient. And I don't want you reminding me and asking me questions." So I honored her request, but I said, "If you ever have a problem, please call me." Because what we have now is so much better than what she responded to originally with one glyconutrient from the aloe plant. In our hospital, we had a nurse that knew about our work at the Fisher Institute across the street, and her husband got to vomiting blood, and this doesn't do justice to the artist thing, but he had a large ulcer in his stomach, and they biopsied it, and it was adenocarcinoma or gastric cancer. I was called in, and They biopsied lymph nodes above and around the esophagus, around the duodenum, and different areas, and there was cancer everywhere spread in the abdomen, even in the mesentery. There were implants of cancer, and I thought they would just sew him up and let it be. At the end of the day, there on the cutting board in pathology, they had removed the stomach, and I asked the surgeon, what was your idea? And he said, well, starving to death with obstruction from gastric cancer is a terrible death. I thought if we could debulk it and connect the upper part of the stomach to the duodenum, he would have better life. They started a regimen of chemotherapy, 3 different agents each week, and then a week off. But because of his nurse wife, he drank through this time the glyconutrient in the aloe juice. He drank the juice. We were early in our development. He gained all his weight back. He quit having such terrible responses to the chemotherapy, and at the end of a year, they talked him into a look-back operation, and under the microscope, every place that there had been cancer, there was scar tissue, and the tumor was gone. It was in the same operating room, same surgeon, same pathologist, myself, and couldn't find any evidence of the tumor. A research oncologist was brought in from Sloan Kettering, and he looked the case over, and I thought he would be impressed by this, but that is not what impressed him. He said with all the chemo he had been on through that year, and he hadn't missed any doses, he went to surgery in the 13th month with a normal hemoglobin, no anemia, normal white count, and normal platelet count, no evidence of bone marrow toxicity. That's what got his attention. Now, we went to Texas A&M trying to get some data on what was going on. And in mice, a researcher down there had a grant to look for anti-cancer substances, and this is called Norman sarcoma. Here are chromosomes, divisions. It is a wild tumor. These are the muscles of the chest wall of the mouse. The tumor is just roaring through. And there's a story behind the story on this that was told to me by Dr. Busby and Dr. Bob Carpenter, a research veterinarian. He knew of the cases I've just shown you, and he knew that Dr. Busby had this grant, and so he took a vial of the white powder isolated from the aloe plant, Aloe polymanose, down and asked him to try it in his models for anti-cancer activity because it's working in humans. He said, what is it? And it says chains of mannose sugars. He says, take that out of here. He was taught the same lessons I was and is still being taught. Sugars are used to burn for energy. And he wasn't going to waste his time on it. But at Carrington Laboratories, where we were working, and I was a consultant for 8 years, the head of research, Dr. Bill McAnally, is a clever person. And he scraped up the money to give an unrestricted grant to the dean of the School of Veterinary Medicine. They love unrestricted grants. They can use any way they want. And at the reception, the dean was said, would you mind having Dr. Busby in your school test this in his anti-cancer models? Dr. Busby said when the dean, his boss, came in and he recognized the bottle, I was not amused. And he told me that with a few curse words, those blankety-blank so-and-sos up in Dallas think they can come in and interfere with my research program. I will test this against Norman sarcoma because no agent whatsoever had ever touched Norman sarcoma. The death rate was 100% regardless of anything ever done. And I'll get you out of my hair. which is thinning, I might add, on him. They injected 54 mice with the tumor. Half of them were controls, and the other half got one injection of the dissolved white powder from the aloe plant. As luck would have it, Dr. Busby went on a meeting to Europe, a meeting here in North America, some holiday time. The state had a weekend holiday, and he got back, he told me, and a graduate student came in and says, Dr. Busby, what do you want to do with the mice you injected before you left for Europe? He said, they all should be dead. He said, half of them are. He says, which half? He says, we don't know, it's coded. They went to the book and all the controls were dead. And all of them that got one injection of the polymannose sugar from the aloe plant were alive. He had flippantly said, just euthanize them, get rid of them, we don't need them now. He says, don't kill them. Let's see what happens. And in the weeks that followed, 60% of the mice finally died, having lived longer than all the controls. But 40% of the mice destroyed all evidence of the tumor whatsoever. He said, there's something wrong. The graduate student injected must have put it on something heat or something other or something that, so he personally re-injected the survivors with twice the amount of Norman sarcoma under their skin, and nothing happened. Didn't even get pimples under the skin like they had been immunized against the tumor cell line. Now Busby was bouncing off the walls. And they took sections of it, and they saw that starting under the skin, the tumor that was solid would get swollen, and white cells would come wandering in and start destroying the tumor cells. And eventually, here you see this shadowy remains of tumor, and this is an edge of where the tumor is dying in a wave, starting from the skin this side down. And one of the things that notice is that in the lower levels of the skin, there are macrophages that are specialized called Langerhans cells that make cytokines, tumor necrosing factor, and interleukins to defend the body. They're part of our skin defense against any infectious agent. And from the skin, it progressed down toward the chest wall. This is the controls in another experiment where they 100% death weight at 45. This was a highly purified aloe powder extract, and this was just freeze-dried, as much like in nature as you could have it, and that 40% of the animals lived. He eventually, not one injection, but gave them 2 injections a week. And this was raised to 65–75% survival in a cell model line that had always been 100% death and still was. He looked at the animals and noted that a day or two before they would die, those that did die, they had big tumors on their sides, those that didn't destroy it, but they would shake and look pale, like they were in shock. And he made the mental note, I bet you if we would have cut those tumors off, that some of them would survive. So he designed the experiment and had to go through Animal Rights Committee. Took 2 years to get permission because, see, you can sacrifice the animals, but if you're going to do surgery on them and let them live, they had to eventually send a graduating veterinarian who wanted to be an academician to mouse surgeon school and get him certified to cut these tumors off and let the animals live. And they continued to do this until they got combining the injections with surgery, which would be more like the way you would handle a human. 90% survival in this model had always been 100% fatal. One day when they were cutting these off, he said, rather than just throw this in formaldehyde and all, let's put it back into tissue culture. And there's a principle called the Hayflick principle that the longer you pass a cell line, it grows slower and slower, and it will die out if you don't put it back in an animal and revigorate it. And so the controls that they had done this, that got none of this material, they put it back in tissue culture and the cells grew rapidly. But the animals that got the injection, the cells of the tumor would grow 5 to 7 days and die over and over again like normal cells instead of a tumor cell line. And we have wanted the funds to do the research because we think that is very important. One of the tests of a malignant cell line is the immortality, that it will grow on and on, many passes, slower and slower. But to take a tumor cell line and reverse this just by injecting this means something very important is going on in those cells. About the time this was going on, there was a paper I picked up by accident in the library from Annual Reviews of Biochemistry 1985. And we had identified that the active ingredient in the white powder from the aloe that was giving benefits in these patients were chains of mannose sugars of various length. And we know that, or I did, that these sugars are added to amino acid chains. But here was a paper, it says assembly of asparagine-linked oligosaccharides. That may not catch your attention, but assembly, you understand the combining of molecules. This means asparagine-linked amino acids and complex saccharides, and we knew that the aloe plant that these people were taking were complex saccharides of mannose sugars. And the Cornfields, husband and wife team, published this review of cellular synthesis and how sugars are used. Because our cells, which we had electron microscopy of here, work like an automobile assembly line, taking parts and hook them together to make completed products, whereas in our body we get nutrients and elements. They're dissolved in the blood and shipped to the cells to make substances that include the production of anti-cancer molecules. On this assembly line, starting with the blueprints of life that include the instructions for anti-cancer activity, assembly line step number 1 in the ribosome, assembly line step number 2 in the endoplasmic reticulum, assembly line step number 3 in the Golgi, that finishes off all the structure as well as function molecules that are synthesized in the body. This is the biochemistry of what goes along on this amino acid chain, and this is where the protein peptide made here, that the sugar, the mannose sugar that is in the aloe plant, that 9 molecules are added to the end of these peptides. This is the domain on the surface sticking out of cells that are read by the immune system to say this is a normal cell. It's the signature of life on the surface of our cells. Or if it's different and it's been changed and it's malignant, that the immune system can say this is an abnormal cell, and then alert and make the production of cells in the white cells and in the liver to make anti-tumor substances when the immune system sees that it is wrong. Anyway, this is the system that produces the molecules that have failed on normal nutrition. This is a Michaelis-Menten dynamics of the assembly line I just showed you that basically says that if you have more nutrients available to the cells, like A plus B to make C, the more A and B you need to make C, which in this case would be anti-cancer substances, the more you can make in less time if you have more supplied. This is the synthesis of anti-cancer molecules, up to a limit. In the aloe plant, which we have is in nature number 1, the mannose sugars are part of 1.5% of the solids in aloe juice. It is 98.5% water. By freeze drying, we can give our cells in a capsule or a tablet what it could take days, weeks, maybe months to get to our cells by freeze drying and taking all the water and fiber out. And so now it is possible to synthesize the anti-cancer molecules like have never been possible before, because this is the status of dietary supplementation, are supplying more components to make anti-cancer molecules. That is theory. This was done by Dr. Galen Marshall, University of Texas Health Science Center in Houston, to test if this theory is correct and would support what is happening in these cancer patients. And the one here I like to focus on is called tumor necrosing factor. That means cancer killing factor that works with other components made in the cell to be able to recognize and destroy cancer cells, as we've seen in the cases presented. And by taking white cells from patients and increasing the amount, in other words, more A plus B, as I said, by concentrating the glyconutrient from the aloe on a dose-response basis, 1, 10, 100, 1,000 micrograms being provided to the cells, they increase the synthesis of anti-tumor molecules within the body under the control of the genes. Well, the next question is, does it work? And in this experiment, they took cancer cells in tissue culture loaded with chromium-51 and took white cells from the last experiment, and this was the control cells. And within the cells are natural killer cells that are the, if you will, special forces or ninja fighters of the army of white cells. They seek out particularly virus-infected cells and cancer cells and kill them if given the signals from the previous experiment. And in fact, cancer cells loaded with chromium-51 with the excess washed out of the culture, set for 4 hours with these white cells that have been incubated with 1 microgram, 10, 100. The leakage of chromium from the cancer cells, this increase is the rate at which these cells are destroying cancer cells. So they are reading the instructions, the cytokines that are like tiny IBM cards passed between cells to destroy tumor. Now, one of the things we found out in the cancer patients, whether they were getting radiation or chemo, the usual nausea, vomiting, overwhelming fatigue, something that's really terrible to them, it's called mucositis. It's so painful in their oral cavity and in their esophagus to even swallow water, much less food, from a reaction. This was done by Dr. Busby down at Texas A&M, and it's a scanning of liver cells in culture. And the importance of this is that in these liver cells, you can see intracellular antioxidants and free radical scavengers. What is the significance of this? Massive. Radiation and chemotherapy creates free radicals to kill cells. And when I said cells, I didn't say cancer cells. You try to target it for cancer cells, but it kills cells. Good cells and bad cells, normal cells and cancer cells. And that is the basis for the symptoms that is so common for a cancer patient that you may know, almost their last words may be to you as they gasp, tell you, if you ever get cancer, don't let them treat you. The treatment's worse than the cancer. And many feel that way. But one of the things, as I will show you at the end of this presentation, is that we have continued evidence that these patients do not have this problem. And this is at the heart of it. But what we're really going to focus on is the blue out here in the cytoplasm with the membrane just above it. Because the master antioxidant in our cells is reduced glutathione, and that is the blue here. So the reduced glutathione is the master antioxidant to keep us feeling good. Fact is, when you wake up, maybe you've had red wine the night before, you don't feel very good. Fact is, anytime you don't feel good, you're generally out of balance with the oxidative status in your cells. But the blue stuff, we found out by scanning these living cells in Dr. Busby's lab, that with normal medium, this is the amount of protection we have inside our cells. By adding 50 micrograms of the mannose sugar that increased the synthesis of our cells, within 5 minutes, you have a 50% increase in protection inside our cells. You can test by an oxidizer which simulates either radiation or chemotherapy that is oxidative there, that if you challenge the control medium, you just wipe out the protection. That's your patient saying the treatment's worse than the cancer. But if you've had this on board, you still have about half to 80% of your protection left, and that's why we keep hearing from patients that they don't get sick. This is also the reason that people that have high blood sugar and diabetes and elderly people, oxidative damage is what causes aging. And it's the basis that we've heard from elderly people adding this to diet and being able to return to activities that they'd given up years before. So at the cellular level, we know better why this works and why the patients are having benefit in almost anything you can think of. And it works. This is a case of a researcher in California that in July 1998, he had a non-healing ulcer on the base of his tongue. He ignored it until he had big, large nodules in his, could be palpated in bilaterally in his neck. Scared him, and with his wife pushing him, he went to the hospital and they biopsied it. They told him, we had good news and bad news. Which one you want first? He says, give me the bad news. Said, you have squamous cell carcinoma of the tongue. We could not remove it all, and it's already metastasized to the regional lymph nodes. He said, what's the good news? He says, we can remove your tongue, bottom jaw, floor of the mouth, larynx, bilateral neck with the lymph nodes, radiation and chemo, and we can get you 2-3 years of extended life in that shape with a tube to breathe in, tube in his esophagus. He basically said, I'm a doctor. I'm not going to do that. And he knew the research I have just shared with you. At this point, he started adding to his diet the missing glyconutrients. And his tongue healed. He was doing so well, he doubled it, and it went up to 85,000. Then his peripheral lymph nodes went away, and he's continued this. I talked to him since the first of the year, approaching 5 years, with no evidence of squamous cell carcinoma, and he still has the half of his head that they were going to cut off and throw away. In 1994, a very important thing happened in the United States. The Dietary Supplement Health and Education Act had passed, and we'd been doing research on the active ingredient from aloe, chains of mannose sugars, trying to get it through the drug approval process, but because we had no toxicity and could not show in the regulatory process that how much it took to kill animals, and then we had too many good things happening in improving physiology. When this was passed, it made it possible that this non-toxic chains of sugars, because it said dietary, and everyone that has a scratch kitchen for cooking has chains of sugars called cornstarch. Glucose is in line. So this broke through our bias in favor of drugs, opened our minds to the importance of nutrition, supplying cells what they need for optimal health. And this became the law of the land, which is a revolutionary statement in medical management. So science has shown that optimal nutrition is essential for good health, to prevent disease, and to restore health. And that's what I've been showing you. Now, this story started back in 1985 with AIDS patients. And I was asked and challenged to do some pilot studies in AIDS patients that claimed by drinking aloe juice that their symptoms greatly improved. I resisted this for some time and finally agreed to do it. What happened in those AIDS patients is not only did their AIDS and their hepatitis improve, but they became a model, a general model for human disease. Because when the virus knocks out the CD4 cells called helper lymphocytes and weakens the immune system, the systems of your body fall apart. They have, for example, rare tumors used to be seen only in old men. This is a Kaplan-Meier sarcoma. And we didn't show the ones on the face and other areas. We just took the foot where it couldn't identify the patient. But by giving him the active ingredient from the aloe plant and also applying it topically, the body began to react again, and it swelled up, and there's edema around here, much like a sprained ankle or around an abscess. And here, eventually, it went away, just scar tissue. And we had this happen on the face and on the body and arms of patients. Not only did their AIDS improve, but this improved. Then one day, a male nurse from Baylor Hospital said to me, "It's a hell of a note." I said, "What do you mean? What's going on around here?" I said, "What do you mean?" Says, "I have to get AIDS. Come here to the Fisher Institute Clinic, and my AIDS gets better, but they've canceled my surgery." And I said, "What surgery?" He said, "Well, we never got around to it. It's not life-threatening and all, and we're focused on AIDS." But says, "I have had ulcerative colitis for years, and I've been having a segment in my bowel despite retention of various drugs. It continued to have terrible pain and symptoms. But I came over here, and all the symptoms and my problems went away, and they scoped me last week, and it's all healed up." Well, we had other conditions. Lymphomas, leukemias, the Kaplan-Meiers, autoimmune diseases, that because of the systems falling apart, that it didn't take a rocket scientist to say, "I wonder what would happen if you tried this in patients that don't have AIDS." Well, you can imagine what happened is they responded. And it's particularly, if you want to know the best responses we see, it's in those conditions that medicine doesn't know what causes the condition. Medicine has no treatment. And furthermore, the treatment eventually gets worse than the disease. That's where it excels. And I think you can understand why. Imagine with me, if you will, that we've never discovered vitamin C. I was showing you where the antioxidant activity in the cells back there. And people die of scurvy because we've never discovered vitamin C. We would try every drug in the pharmacopoeia, and it wouldn't work. Imagine again with me that we have a group of these children that on TV have seen the segments of Flipper, and with the I've Got a Dream Foundation, their hope before dying of scurvy is to go down in the Caribbean and swim with the dolphins. And so they put a plane load of them down there, and while they're there, you can imagine they might load them up on lemonade, orangeade, limeade, and they would come back and they don't have scurvy. We would put together a multi-million-dollar task force and go down there, and we would discover that a micronutrient called vitamin C was what was doing it, not a drug. Here's an example of a benign lesion in children. This is a vascular hemangioma on a newborn infant. And to his diet, they added, now this is proliferation of blood vessels that are benign versus the Kaplan-Meiers in the AIDS patients. But by applying topical occlusive bandage with the products, essentially making a semi-culture in the moist area and giving it to them orally, it goes away. And kind of like what the magicians at Las Vegas never do the trick twice. Here's another child that on the shoulder has an elevated vascular hemangioma. You can see it there, and we get this picture before it's totally gone, so you can see that it's fading away. Sounds like something very good at the cellular level is going on, doesn't it? Well, here is a child, Cameron, that was born with a lymphangioma. that at 18 months, despite prednisone and Myloran, everything they were doing, it progressed until they had to do a tracheostomy to breathe. And they continued to give prednisone and Myloran with no benefit. And finally, someone hearing this lecture went to the family and told about this type of information, and they started, and in 21 days of adding missing micronutrients that you know more about than you think you do, if you know the difference in taste of vine-ripened tomatoes versus those picked green shipped across the country, held in the back of the market until they're red enough to fool you. You take them home and they're tasteless red mush. You know there's something missing, not only in the tomato, but all fruits and vegetables picked immature. That's what shrunk this down, and now this infant, we have found out recently, is off of all medications, has no problems with this proliferation that was life-threatening. The tracheostomy tube has healed up, osteoma without scarring, and is a happy little creature and family. To end up with, one of the big problems in cancer therapy is they talk about 5, 10, 15, 20-year absence of disease. But there are cancers that from the time of diagnosis until to death is an average of 6 to 12 months. And one of these is pancreatic cancer. And this is a gentleman that came to us at the Fisher Institute. He had lost about 35 pounds. He was yellow as a gourd. And they took him to one hospital, and they finally went down and did a biopsy in his bile duct and up toward the pancreas. And this is normal epithelium. I like to, as we sit in a room with chairs, they're all lined up in the right place, and the cells all line up and are orderly. And everyone's just about the same size and looks very similar. But this in his biopsy, if you'll notice, there's very marked difference in staining, size, and they're disorderly. And this is what you look at for cancer of the pancreas. And that was the diagnosis made on him. Even higher power, you can see chromosomes that you're not supposed to see, and irregularities to make the diagnosis. Well, because of a mutual contact, he called the Fisher Institute while I was out of town. But with the help of my secretary, he was started on the micronutrients in large amounts. Interestingly enough, on this case, they had told him, Tom, we can treat you and you'll be miserable and you'll be dead in 6 months. Or we can not treat you and you may have some good days. And at your age, every day that's good is pretty good, because he's in the late 70s. So he went home and did start the glyconutrients as his intervention. And in 6 months, he went back to the hospitals where he'd been, and he'd gained his weight. His jaundice was gone. He had energy. And they laid all the studies up and told him, says, Tom, it's incredible. There's been a miracle. We cannot find any evidence of your pancreatic cancer. Much like the gentleman with the tumors in the lung that played tennis that I told you about, every time we saw this gentleman, we were missing the importance of something beyond the cancer response. He looked younger. And one day I said, you know, you're looking younger, what are you doing? And I found out his passion in life was fancy ballroom dancing. And he says, I tell you what, I'm just getting more energy. He says, when I start to do the bossa nova and the samba about 2 o'clock in the morning, I'm having to get younger partners. Here's another pancreatic cancer. These are impact cases. This is a nurse from upstate New York. And this is a papillary cystadenocarcinoma of the pancreas that she had, but she had metastasis to her liver, and this is a biopsy from her liver, and this is a scan of her liver, And here's tumors here, tumor here, tumor here, tumor here. You just see filling up. And there's one that, to estimate the size of it, in July '99. She started increasing the micronutrients in her diet. And 1 year later, that same mass, if you'll notice, her whole liver is down and other masses, but that one that we were following there is this size. And she is now, I talked to her about 2 weeks ago, alive 5 years with pancreatic cancer. That gets people's attention that are experts in the field. In addition, in North Dakota, there's a Mayo-trained oncologist by the name of Glenn Highland, and he saw some patients that had these type of responses. So he gathered over 100 patients where these micronutrients, the glyconutrients, the phytonutrients, and the phytogenins, vitamins and minerals in the natural organic matrix, not synthesized from chemicals, were given to 100 patients, and this is what he reported in Washington. That the standard treatment was not neutralized by the dietary supplements containing antioxidants and micronutrients. The residents in training in oncology are still being taught, tell your patients, don't take antioxidant vitamins. I have references of over 400 papers that this is not right, and that was one of the first things that Dr. Highland said. It didn't stop the chemo or radiation it was combined with from working. Fact is, in his experience, radiation chemo effect against tumor cells was enhanced, more effective. Never seen metastatic tumor shrink and go away so totally, so rapidly. That could be terrible. Because if you know, radiation and chemo kill cells without the next point. Normal cells, bone marrow, liver, kidney, mucosal basal cells were protected from treatment damage. If you don't get that, let me translate it into Texan. You kill the bad uns, you protect the good uns. That is what's been needed in cancer therapy from day one. In addition, Dr. Highland showed cases of sarcomas and huge tumors that never respond to anything, and combined with therapy that never works, they shrunk markedly. The quality of life while having the treatment was improved significantly. If there was nothing else that this did, this would be a major improvement for the patients undergoing cancer therapy. When I first started on this 18 years ago, I was more than once introduced as a visiting heretic, and received a lot of criticism and condemnation for even working on this, but I only show you this, that there are over 20,000 scientific and medical journals in various languages on planet Earth. In the top 10 are the journal Science and Lancet. And in Science, in March 23rd, 2001, there are 12 articles on glycoscience and glycobiology, these sugars that we've been discussing. And the importance, and this cover shows on the surface of our cells the sugars that are the signature of who we are, and also the receptors and what the immune system reads to determine normal cells versus malignant cells by the changes in these sugars. In this issue of Lancet, also in the top 10 of journals, is an article, a review of over 38 infectious agents respond to complex sugars to destroy and inactivate viruses and destroy infectious agents. There's a journal that American Nutraceutical Association, founded by a group of pharmacists. Here is a journal with a review on this, one-page review from MIT, from Oxford University in England, a glycobiology journal, a sugar science journal that's been going for more than a decade, and then from Switzerland, issue that contains 15 articles on the importance of glyconutrients in life. Hey, that's kind of an endorsement, I would say. And then I end with the fact that decades ago, Roger Williams, who died at the age of 94, approximately 20 years ago, wrote 12 books on nutrition. And in those books, there is one important one in 1971, where he says, the theme of my life's work and all my books is in one sentence. He says, the human body heals itself and nutrition provides resources to accomplish the task. In his book, Nutrition Against Disease, published in 1971, is this statement, and I honor him because the last 18 years, I would say, has just been a constant validation and confirmation of the insight that Dr. Williams had, and it works. It improves quality of life in multiple chronic diseases. It is not treatment. It is providing support through nutrition, because the human body heals itself and nutrition provides resources to accomplish the task. Thank you very much.